I want to welcome you once again to this second part of the lecture on Introduction to Human Anatomy. In this second part, we are going to look at anatomical terms. The main aim is to familiarize with the language that is used in anatomy. You remember in the first part, we looked at the definitions of human anatomy, and we also looked at the scope of the different divisions of human anatomy. So in this second part, which is the last part of introduction, we'll just focus on the anatomical terms. In specific, we are going to look at the following. There is something called the anatomical position of man. So we are going to describe the anatomical position of man, and we are going to state its importance. Then in the second part, we are going to define the terms which are used to describe the position or location of different organs and body parts. In the third part, we are going to describe the anatomical planes. We will name and describe them, and perhaps also see how they're important. Why are we learning them? And in the fourth part, we are going to look at the terms which are used to describe movement, terms of motion. So let's begin with the first agenda, which is the anatomical position of man. Before we start that, perhaps I just want to demonstrate something, and I hope you can see my video. So I'm holding a phone, and I hope you can see the phone I'm holding. At this point in time, we can say that this phone is on top of my hand. Yet when I turn it like this, we can say that this phone is below my hand. And if I do like this, perhaps you want to use the term beside. If I do that, perhaps you want to use the term in front. And if I do that, perhaps you want to use the term behind. But critically evaluating the situation, you realize that the position of that phone has not actually changed in all those maneuvers I've given you. The relationship between my hand and the phone did not change. What was changing was the position of my hand. So look again. We can say that is in front, this is behind, below, on top, beside. Yet the relationship between that phone is not changing when we compare it with my hand. That is the dilemma. The dilemma here is that depending on the position of the body, there are many terms of description, terms that can be used to describe the relationship. You can use different terms to describe different relationships. But we can also, I'm concerned with the fact that we can use different terms to describe the same relationship. That is very possible. And if that is very possible, then the dilemma here is that we can actually lose out on communication. I may use a particular term to refer to something, but it totally means something else in the other end. If two people are having a conversation regarding relationship of some two things in the body, and one person has the advantage of seeing that thing physically, and the other person doesn't have that advantage. So they're relying on the description of the first person. It is very possible that the second person may not actually get the correct information that was intended by the first person. Because we've just seen we can use several terms of description of relationship just to describe the same thing. How do we then harmonize this and ensure that what you tell me over the phone in one end is actually the message I get on the other end? That is why we have this particular concept of anatomical position of man. The anatomical position of man is a standard position of reference. It is the position of reference that we assume the body is in when you are describing relationship of different organs. So therefore, we use the anatomical position to describe location and position of body parts or organs and how these organs or position or parts are related with others in the body. It is a standard position of reference. And this standard position of reference just tries to make sure that when you are describing things, we don't have to manipulate the body. You assume the body is in a particular static standard position. So that if I was to describe the relationship between my phone and my hand, I will not give myself the degrees of freedom that I had initially of manipulating my hand or forearm several times. I will take only one standard position of my forearm or my hand, then use that to describe the relationship between my hand and that phone. And that makes it standard so that wherever you are in the world, if you tell me that that phone is in front of my hand, then I know what that means, irrespective of the position of the hand. So what is this anatomical position? In the anatomical position, we assume that the person is standing upright, as you can see here. So the anatomical position of man is an upright posture. That is to mean that when you're describing things in the body of a human being, even if that particular human being, let's use the term patient in this case, because perhaps many of you listening to me are going to be clinicians, and so you'll be describing about patients. When you're describing the relationship of some two things in a particular person, and in this case, a patient, even if your patient is lying down on a couch or on the bed, you assume that that person is actually standing upright when you're describing the relationship of those things. So it's an upright position. In this upright position, the neck is straight. The eyes of the individual are facing forward, as you can see in this person. The upper limbs are on either side of the trunk, as we can see. And importantly, look at the hand. The palm of the hand faces forwards as opposed to backwards or sides. Look at the feet of the person. The feet of the person are together. The knee is straight, or we can use the term extended. The hip is also straight, we can use the term extended. So this is the anatomical position of man. This is the position we use to describe relationship of different organs and parts of a human being. And so you assume that that person is in this particular position when you are describing the different types of relationships that you would wish to describe. Great, I hope you've understood why we have the anatomical position of man. So if we were to take back the question I asked earlier, or rather what I demonstrated earlier about the relationship between the phone and my hand, I started by holding it this way and we said it was on top. But now in the anatomical position, I can't put it that way. Even if I'm holding this way, I'll assume that I'm actually in this particular position. And so the best description that I can give between my phone and my hand is that the phone is in front of my hand, because I'm assuming I am in the standing position with my forearm and hand in that particular position so that the palm is facing forwards. I want you to think through that again and again and give yourself other examples, but make sure you familiarize with the anatomical position of man and why it is so important that we describe relationship of different things in the body with reference to the anatomical position of man. Our second objective is to describe to define the terms that we use when we describe position or location of different structures. Now these are the terms that we use to describe position and location. And when we compare them with others, then that will be relationship, how these organs are related to others. Remember again, we do this in the assumption that the person is in the anatomical position. Before I take you through these terms, I want you to understand that the terms of position are relational terms. This is to mean that these terms we are using them when we are comparing with another thing. You don't just say that the phone is in front, but we say the phone is in front of the hand. You must be comparing at least two things. They are relational terms. They are not absolute terms. If it is in front, it must be in front of something. If it is behind, it must be behind something. If it is on top, it must be on top of something. And if it is below, it must be below something else. We want to hear the concept of relationship. With that, therefore, the first term that I want us to describe is the term superior. The opposite of superior is inferior. From basic English, superior means above or on top or high. And inferior means below, in the bottom, or low, basically. We use the term superior and inferior largely when you're describing things within the head region, the neck region, and the trunk region. And I want you to get that right. We rarely use the term superior and inferior when you're describing things within the limbs. I'm not saying never, I'm just saying rarely. So in most occasions, we use the term superior and inferior when you are comparing things in the head, neck, and trunk. And I want you to train yourself for that. So with that in mind, something that is above another one within that region that I've outlined to you will be superior compared to the other one. For example, we can say here that the head is superior to the neck. Or you can say that the neck is inferior to the head. I can still say that the thorax is inferior to the neck, but that the neck is superior to the thorax. Try to use other things, possibly the ones which are inside, to try to figure out the relationship. Think through the heart and the diaphragm. So the diaphragm is inferior to the heart, or the heart is superior to the diaphragm. Think about the right lung and the liver. The right lung is superior to the liver, and the liver is inferior to the right lung. Instead of using the term superior and inferior, we can use the term cephalic, and the opposite is caudal. Cephalic here literally means towards the brain, and caudal means towards the tail, in the understanding that you may not necessarily be having a tail. You can pick it as caudal is away from the head. Remember again, we are working with head, neck, and trunk region. And so if you assume this person doesn't really have the limbs, upper limb and lower limbs are not there, the tail in quotes will be actually the lowermost part of this individual. So we can say, therefore, that the neck is cephalic to the thorax, or the thorax is caudal to the neck. Similarly, we can use the term cranial, and the opposite is caudal. They still mean the same. Cranial is toward the skull, which means towards the head, which means basically towards the brain or superior. And caudal means towards the tail. Right. In the limbs, something very close to superior stroke inferior would now be these terms proximal, and the opposite is distal. What does proximal mean, and what does distal mean? The term proximal is used to refer to how close, or rather the term proximal and distal are used to describe how close some parts of the limbs are to the trunk compared to others. Remember, the limbs are attached to the trunk. So the closer a part of a limb is to that attachment, the more proximal that part is. And the farther a part of a limb is from that attachment, the more distal that part is. Proximal means closer to the origin in the trunk, or closer to the attachment in the trunk. And distal means away from the attachment in the trunk. So for example, I can say that the leg is distal to the thigh, but that the thigh is proximal to the leg. The leg is distal to the thigh, yet the leg is still proximal to the foot. The knee joint is distal to the thigh, but that knee joint is proximal to the leg. We are comparing how close that part is from the origin to the trunk. I wouldn't expect you, therefore, to compare thigh and arm and be using the term proximal and distal. The segments you're comparing should be within the same limb axis. I also wouldn't expect you to pick something in the trunk and something in the limb, then use the term proximal and distal to compare them. For example, I wouldn't expect you to say that the liver is proximal to the thigh. That would be very inappropriate use of the term proximal and distal. The next set of terminologies I want us to describe is anterior, and the opposite is posterior. The term anterior means towards the front, and the term posterior means towards the back. That sounds more straightforward, but let me give you examples. I can say that the breasts are anterior to the chest wall. I can say that the sternum is anterior to the heart. I can say that the nose is anterior to the throat. So something in front is anterior, compared to another one that is behind, which is posterior. In human beings, we can use the term ventral to mean anterior and dorsal to mean posterior. But in animals which go on four, the term is quadrupedal. The quadrupedal animals, the ventral and the anterior may actually be very different things. But in human beings, because we are upright, anterior and ventral can be used interchangeably in many occasions. The other term I want us to be familiar with is medial. The opposite is lateral. The term medial means closer to the midline. This broken line represents the midline. The term lateral means away from the midline. So let's say we are comparing the heart and the lungs. The lungs are lateral to the heart, but the heart is medial to the lungs. Let's compare the sternum and the breast. The breasts are lateral to the sternum. The sternum is medial to the breast. You can still compare your nose and your eyes. Your eyes are lateral to the nose. That means that the nose is medial to the eyes. When we are in the region of the upper limb, we can use these terminologies to mean medial and lateral. The term ulnar means medial, and the term radial means lateral. Remember, we commonly use these ones within the region of the upper limb. So if you're describing things within the upper limb and one is closer to the midline compared to another one, you're allowed to use the term ulnar and radial. For example, you can say that the thumb is radial to the index finger, while the index finger is ulnar to the thumb. We can also describe the term superficial and deep. Superficial means closer to the surface. It could be the surface of the whole body, which means closer to the skin, but can also be the surface of an organ, a single organ. So when something is closer to the external surface, then that thing is superficial compared to the one that is away from the external surface, which is then termed deep. A good example would be to compare your muscles and bone, and generally, muscles will be superficial to bone. I want us to describe other unique terms. You may not use them so commonly in the body per se, in terms of describing organs, but you'll use them more in a clinical setup when you're describing some pathologies and the side of the body that are affected, when you're describing some related pathologies. Unilateral means one side, which means that something may have happened or occurred only on one side. That is unilateral. So it can either be the right side or the left side. Bilateral means both sides. So in this case, we are describing an event or a structure that occurs on both sides, which means right and left. So we use the term bilateral. Unilateral is one side, bilateral is both sides. I want us to describe ipsilateral, and the opposite is contralateral. Again, more in clinical setups. Ipsilateral means the same side. Let's take an example of two events related, and they both occur on the right side. For example, let's assume that we have a patient who has a growth on the right side of the brain. And because of this growth, one of the lower limbs is paralyzed. So you understand that the paralysis is unilateral because it's only one lower limb paralyzed. But we want to know which lower limb is actually paralyzed based on the side that the growth in the brain is. So if the growth in the brain is on the right side of the brain, and the paralysis associated that growth is also the right lower limb, then we can say that this patient has ipsilateral lower limb paralysis, which means we are comparing the side of the pathology in the brain on the right and the pathology on the lower limb on the right. They're both on the same side, so ipsilateral. The opposite of that would be contralateral, which means the other side. So contralateral here would mean that the growth is on the right side, yet the paralysis is on the left side. So that is contralateral. Or the growth is on the left side, then the paralysis is on the right. So that is contralateral. Opposite side. Another term we're likely to come across, though not so much again, in terms of describing relationship of organs, but we may get it so much in just naming some layers in the body and also in embryology. The term is parietal and visceral. The term parietal means external layer, outer part, and visceral means the inner part or the inner layer. These ones are generally used when describing layered organs, layered structures. So the outer layer is the external layer, parietal is a term, and the inner layer is the visceral layer. The term viscera actually means hidden, so inside. Good, we're done the second objective. Now I want us to look at the third objective, where we are going to familiarize with body planes. There are three planes in the body that I want to describe. The first one is a sagittal plane. The sagittal plane is a plane that splits the body into right and left part. For example, if you look at my video, the plane that splits me this way into a right and a left part, that plane is considered the sagittal plane. A sagittal plane can be through the midline of the body, which means it will split me into right and left equal halves. If the sagittal plane is through the middle, which means through the median, the midline of the body, then we can call it the median plane or the mid-sagittal plane. Of importance to note is that the median plane divides the body into right and left equal halves. Perhaps again, you need to realize that even though this right and left are equal, they may not necessarily be symmetrical. Because remember, there's some organs in the body which are only on one side. So even though we are having right and left part, the right part is not necessarily the mirror image of the left part in as much as they are equal. So equal, but not symmetrical. Sometimes they could be symmetrical, but they don't have to be symmetrical. If the sagittal plane is not in the midline, it means it will divide me still into right and left part, but this right and left part are not equal. One side be larger than another one. The term we use for that kind of sagittal plane is parasagittal plane. So I hope you've understood what sagittal plane is. The other plane I want to describe is the coronal plane. We can call it the frontal plane. The coronal plane is the plane that divides the body into an anterior and a posterior part. So a plane that way, splitting me into an anterior and a posterior part. That's the coronal plane, otherwise known as the frontal plane. And the last one I want to describe is the transverse plane, or normally we call it the axial plane. The axial plane or the transverse plane, you have to be a bit keen here, because if you are like me those days, then I would have easily imagined that the transverse plane is a plane that divides you into a superior and an inferior part. But that's not quite accurate. The transverse plane is a plane that cuts at 90 degrees to the long axis of an organ, or the long axis of the body. So the plane that cuts at 90 degrees, the plane that is at right angles to the long axis, is the transverse plane or the axial plane. Now that the long axis of the body is vertical, the transverse plane is definitely dividing the body into a top and a bottom part. But not all the time will that be the situation. For example, think through the transverse plane of your big toe. It cannot be what you think as top and bottom. It has to be at right angles to the long axis of that particular toe. Again, transverse plane is not necessarily horizontal plane. Yes, there are situations where that can be, but not all horizontal planes would be axial plane. Having showed you, or rather having defined for you different planes, I want to play a few videos for you and expect you to be able to identify the body region as well as the plane in which the images that I'm playing have been acquired. This is the first one I'm playing for you. So I want you to be able to identify which body region is being imaged. It's a video, so I'm going to play it. And which plane are the images being acquired or have been acquired. That's the first video. I hope you can see it clearly. It's playing for you now. Still playing. By now, I believe you should be able to know which body region is this, and in which plane have the images been acquired. I will leave it to settle there. Okay. I'll give you another one. I have several of them. So this is the second one. Same thing. Your aim is, your objective is to be able to identify the body region that is being imaged, as well as the plane. Great. So I hope in the first image, you settled on it being axial. And on this second image, you've settled on it being sagittal. This one particularly is mid-sagittal at this point, but at this point, that is parasagittal. This is parasagittal because not through the midline, or even that one, that is still parasagittal. But now that one is sagittal, mid-sagittal plane. I still have more. This one is showing you another video, and I hope you're going to call it coronal. Now, it is my hope that you've realized again that the three videos I've shown you are actually videos acquired from the head and the neck region. So they're basically for the head region, but yeah, there's some of them that have neck, so head and neck still okay. But they were primarily focusing on the head because it was aimed at imaging the brain. So this is coronal images of the head or brain. Another one, I still have more videos for you. So this one is also playing right now. The agenda is to be able to identify the region and the plane of the image. Okay, I'm giving you a second to make your mind about it. Your second is over. I hope you've settled on axial image of the thorax. Body region is thorax. The plane is axial. Another one. So this one is actually similar with the previous one. Still, body region is thorax and plane is axial. The only difference that in this particular image, we are not seeing the lung structures so well. It's dark. In the previous one, we would see the outline of the lung more prominently. These are CT scan images. The previous one is called CT scan in the lung window, and this one CT scan in what we call the mediastinal window. We don't have to go into those details for now. Then this one here is coronal CT scan, again, of the thorax. And I hope you see why then I call this coronal. This one has been acquired in the coronal plane. Okay, I'll give you last two, which I'll not tell you what they are. So it will be up to you to then think through them. This is one of them, that's the first one. And that is the second one. So I leave those up to you to make your decision. Okay, I forgot there are two more still for you. Remember, you need to identify the body region and you need to identify the plane in which the images have been acquired. So that's the third one. I believe this will be the last one. Right. So that I've left for you, those last four, to just think through which body region and which plane. Let's do the last agenda, which is to talk about the terminologies which are used to describe motion, terms of movement. We may not be able to demonstrate because we're in a virtual class, but in a physical class, this would be much easier. In this virtual class, we'll just define, then I'm hoping that I'll communicate candidly, and also that in practice, you'll also try. And if you have a colleague where you are both in the same class, then in a matter of discussion, that should be very easy. Before we talk about terms of motion, I want to inform you that movements occur around joints, as I mentioned in the previous class, and that movements are caused by contractions of muscles. When muscles contract, they move the bones that they're attached to. And because of pulling the bones, those bones move around the joint. So you'll find that muscles will be crossing at least one joint. And because it crosses at least one joint, when it contracts, then it will move the distal bone most of the time on that particular joint that that muscle is crossing. So with that in mind, therefore, what are the terms of motion that I want to describe? There's some terms of motion that I call basic movements. I'm calling them so because they are so much all over the body. The first one I want to talk about is flexion. The opposite is extension. To flex is to reduce the angle at a joint to extend is to increase the angle at that joint. So the image here, this is the joint. To flex is to reduce the angle at that joint, in this case, the elbow. And to extend is to increase the angle. I forgot to tell you, but not too late, that when you're talking about movement, it is important that you indicate the joint we are referring to. You don't just say, this is flexion. It is important that you tell us this is flexion of the elbow. This is flexion of the wrist. This is flexion of the hip joint. This is flexion of the knee joint. So before I give you much of that, so imagine from a standing position to a squatting position, your knee joint will be doing something. So from a standing position to a squatting position, your knee joints are flexing. And when you move from a squatting position to a standing position, your knee joints will be extending. How about in this image? So this is elbow flexion. That's elbow extension. The other term of movement I want to talk about is adduction. The opposite is abduction. To adduct is to bring a part of a body towards the midline. And to abduct is to take away from the midline. So if you can see my video, in this shoulder joint, this is abduction of the shoulder joint. I'm taking the upper limb away from the midline. And this is adduction of the shoulder joint. I'm bringing the upper limb towards the midline. Then you have rotation. Again, I want you to get the correct definition of rotation. Rotation is the movement around the long axis of a body region or an organ. It's the movement around the long axis of a body region or organ. If you are rotating away from the midline, we call it external rotation or lateral rotation. And if you are rotating towards the midline, then we call it internal rotation or medial rotation. Many joints in the body can rotate, and at your own time, you can figure out how those rotations work. For example, look at this person here. So this is rotation of the hip joint. This limb can rotate at the hip joint. So if the toes go laterally, that's lateral rotation. If the toes go medially, that's medial rotation. This shows you extension of the elbow. This is flexion of the elbow. This shows you adduction of the shoulder, and this is abduction of the shoulder. When we combine those 3 or 6 movements that I've described, flexion, extension, internal and external rotation, adduction, abduction, if you have a movement that combines all of them together at once, then we call that circumduction, like what I'm doing right now. In the shoulder, I'm flexing, extending, adducting, abducting, and rotating. And that's what we call circumduction. It's a combination of multiple movements. Okay, then there's some other movements which are unique to some regions of the body. I want to talk about some movements which are unique in the upper limb. We have what we call supination, and the opposite is pronation. Supination and pronation is a movement that occurs at the radioulnar joints. And this movement is primarily for manipulating the position of the hand. So if I move my radioulnar joint in such a way that my hand turns so that the palm of my hand faces the sky, then I call that supination. And if I manipulate the other way around, as I'm showing you in the video, I call that pronation. So this is supination, the palm faces the sky, and this is pronation, the palm faces down. We have opposition and reposition. This is a unique movement of the thumb. Opposition is a movement that brings the palmar aspect of the distal side of the thumb toward the palmar aspect of the distal part of any of the four fingers. So this is opposition. That is opposition. That is opposition, and that is opposition. So opposition means that the palmar aspect of the thumb is moving towards the palmar aspect of any of the other four fingers. And remember, we are looking at the distal parts of those digits. So we are not talking about this, we're talking about that. We don't oppose like this, we oppose like this. Then reposition is the opposite. When they move away from the thumb, any of them. Then you have ulnar deviation and radial deviation. This is a movement best described in the wrist. So look, this is my wrist joint. This is flexion of the wrist. That is extension of the wrist. That one is easy, flexion and extension of the wrist. But if I put my wrist this way, you notice that my wrist can still move that way and that way. Now, this movement of the wrist is what we call ulnar deviation. That movement of the wrist is what we call radial deviation. When the wrist is moving towards the small finger, that is ulnar deviation. And when it's moving towards the thumb, that is radial deviation. So why the term radial and ulnar? Remember, ulnar means medial. So it's a medial deviation, which means towards the small finger. Small finger is medial to the thumb from our previous terminology. Then radial deviation means lateral deviation. In actual sense, therefore, ulnar deviation is actually what was supposed to be adduction. And radial deviation is what was supposed to be abduction. But because you don't necessarily adduct and abduct in that particular neutral position, anatomical position, when we do deviations of the wrist, it's most cases when you're performing an activity, like right now doing that, and not necessarily being in a static anatomical position. We prefer using ulnar deviation and radial deviation as opposed to saying adduction and abduction. So this first image shows you supination and pronation, as I told you. We don't have opposition and reposition in these images, but this second image shows you flexion and extension at the wrist. This other image shows you ulnar deviation and radial deviation. This last image is important. It shows you how we describe adduction and abduction of the digits. It's different from how we describe adduction and abduction in the other parts of the body. When you're talking about the digits, and the digits here mean either the toes or the fingers. This is how the digits abduct when they flare away from each other. And this is how they adduct when they move towards each other. For the hand, the reference line is the third finger. So the middle finger is the reference point. They move away and towards the middle finger. You can turn yours and you realize that the middle finger doesn't move much. But in the foot, the reference is the second toe. So counting from the big toe as the first one, so the second one is the reference point. The toes move away and towards the second toe. And so that would be the reference point for adduction and abduction. This other one shows you flexion and extension of the fingers. So when I do like this, I'm flexing the fingers. When I do like this, I'm extending my fingers. Extension, flexion. Great. Apart from those unique movements in the limbs, we also have some other movements in other parts of the body. Let's talk about the ones in the lower limb, the unique movements in the lower limb. We have plantar flexion and dorsiflexion. Plantar flexion and dorsiflexion is a unique movement of your ankle joint. To plantar flex is to move your ankle joint in such a way that your toes go down and your heel become raised. In simple terms, the plantar aspect of your foot has flexed, has gone down. Or let me say this, you flexed your foot towards the plantar side. In plantar flexion, you stand on your toes if you are standing. Dorsiflexion is the movement of the ankle that makes the toes go up and the heel go down. So in dorsiflexion, we stand with our heel. In simple terms, dorsiflexion is when you move, you flex the foot towards the dorsal side. I'll show you images. Then you have inversion and eversion, also unique movements of the foot. Inversion is a movement of the foot that makes the sole of the foot to face inwards, internally. And eversion is a movement of the foot that makes the sole of the foot to face outwards, externally. Those ones are better done with images because I can't show you. So the first image shows you inversion, the sole of the foot facing inwards bilaterally. And in the second image shows you eversion, again bilaterally. The third image here, perhaps the second image, or depending on how you're counting. So in this first one, the toes go up and the heel down, that is dorsiflexion. And in this second one, the heel is up and the toes are down, this is plantar flexion. Right. Apart from those unique movements in the limbs, there are other movements still that I want to finish with. There is what we call elevation, and the opposite is depression. To elevate is to take upwards, and to depress is to take downwards. So think through what can elevate and depress. Your shoulders can elevate and depress, as I'm showing. This is elevation of the shoulder. This is depression of the shoulder. Your eyes can elevate and depress. For example, if you look at my pupil, that is elevation of my eyes. This is depression of my eyes. Your mandible, the lower jaw, can elevate and depress. Think about that. Which of those two movements of the jaw will actually make you open your mouth? Is it elevation or depression of the mandible? Then we have protraction and retraction. To protrude is to take forwards, to retract is to go back, to take backwards. So what is it in the body that can protrude and retract? Your tongue is a good example. When your tongue leaves your mouth and come out, that is protraction of the tongue. And when it goes back, that is retraction. Your shoulders are also a good example. This is protraction of the shoulder. This is retraction of the shoulder. Perhaps not so good in the video. Let me turn this way. So this is protraction of the shoulder, and that is retraction of the shoulder. Even your lower jaw can also protrude and retract, and perhaps an image would be better for that. So in this one, that is elevation and that's depression. I think that's straightforward. Now, this is what I was telling you. So this is to protrude. Your lower jaw has protruded and it has retracted here. Right, so those are the terms of movement that I wanted you to be familiar with. So I hope with this lecture, you are able to state the importance of the anatomical position of man. I also hope in this lecture that you are able to describe the anatomical relationship of the following. And I'll give you some 1 minute on this one to just look at it and think through them. How would you describe the relationship between patella and your knee joint? How would you describe the relationship between your mouth and your nose? What terms of relationship would you use to describe the relationship between the heart and the shoulder? How about the relationship between your two eyes? What term would you use for that? And how about your big toe and your small toe on the same foot? What would you use to describe those? Let me give you like 1 minute to just clear that list in your mind. Okay, the good thing about a recorded lecture is that you can pause, so I don't have to wait for the long minute. Let's proceed now. So if you're in a setup where you're able to meet with your classmates to just discuss, then I would encourage you to also demonstrate the following movements amongst yourselves. How does the hip flex? How do the fingers abduct? How would you demonstrate a wrist radial deviation? How do you protrude the shoulder? How will your shoulder do internal rotation? And lastly, circumduction the shoulder. I think that one I've already shown you. So we'll stop there. I hope you've learned something about terms of movement, terms of location, anatomical position, and terms used to describe body planes. Thank you very much. So that marks the end of the introductory lectures in human anatomy. We've done the first and the second part now.